numbers means that we should stay the course right now and should continue to do what we've been doing for the last month, and that is to have everybody play a part in trying to make sure that we can work through this pandemic. So it's a difficult decision, I'm sure, for the governor, but it's a decision that we're supportive of because we want to see our economy come back. We want to see people be healthy. And the best way for us to get our lives back to normal is to continue to do what we've been doing for the last month. We know, again, that this is causing a hardship, an economic hardship. And all you have to do is look at the unemployment claims and see the difficulties that small businesses are having. And I am very sympathetic to that. And so what I want to do here at the local level is concentrate on those steps that we can take here so that we can, as quickly as possible, defeat this pandemic and get our economy moving again. And one of the keys to that has been identified by virtually everyone who's looked at this is making sure that we have more expansive testing. And so a lot of the energy that I've been spending and a lot of the energy that Commissioner Kowalik has been spending has been to work with the state and work with others to see what we can do to achieve more testing here in the city of Milwaukee. And to put this in perspective, in Winnebago County, they have 30 cases. In 2 census tracts, not zip codes, but census tracts, which are very much smaller than that. One on the far northwest part of the city of Milwaukee, which is not that far from Brown Deer, and I see President Montgomery on the picture as well. The other in the northeastern part of the city of Milwaukee, just north of Capitol Drive. Both of those have 30 or more positive cases of COVID-19 in one census tract. So we have as many in one census tract as you'll see in all of Outagamie County, which is where Oshkosh is located. I'm sorry, Winnebago County, where Oshkosh is located. So that underscores just the intensity that we're seeing with COVID-19 in parts of the city of Milwaukee. So then the obvious question is, all right, how do we move to more testing? How do we get more testing? And for the first couple of weeks that we were dealing with this, the real issue was that we had to make sure that our healthcare responders, our healthcare workers, as well as individuals in the hospital, that they receive the testing. And we basically have accomplished that to a considerable extent. The next place to go, of course, is the first responders. And that's something that is still a work in progress. But we think that is going to be a key to allowing us to go then for more localized testing. And what I want to see is more community testing that will allow us to go to some of these neighborhoods that are truly hotspots and do more testing in these areas, literally right in these areas, many of which are not served by hospitals and physicians' offices. That's the challenge we have in Milwaukee, is that there's a considerable amount of people who, when we say work through your provider, they don't have a provider. They simply don't have a provider. And so we have to be responsible and do what we can to make sure that they can have access to the testing as well. So again, to take a further step, one of the announcements that was made in the last several weeks was the partnership with Exact Sciences. Exact Sciences is a company out of Madison, which does tests for so people don't have to have colonoscopies. It's an at-home test to make sure that you don't have colon cancer. But they have the capacity and the capability also to do testing for COVID-19, and in fact have entered into agreement with the state of Wisconsin to provide literally tens of thousands of test kits to the state of Wisconsin. At this point, the demand for those test kits is not there. And what I want us to do here in Milwaukee is I want us to work with the state of Wisconsin, with Exact Sciences, and see what we can do, not in weeks, but literally in days, to bring those test kits here so that they can be implemented in our community. And so I've had conversations with Dr. Raymond at the medical college, with Weston. I've been talking a lot to representatives from the state. Obviously, Commissioner Kowalik is very, very, very much leading this effort to make sure that we're going to have community testing. That's important because we know that it serves 2 purposes. One, it allows us to literally study this issue. And when I say study this issue, it's important for us to be in the community to see exactly what's happening. But to me, even more importantly, is to the extent that we can identify individuals who are positive, we can take steps that are necessary. And those steps, of course, are to test them. And if they test positive, to make sure that they are isolated in quarantine, and then to do the tracing, which is the third part of this, and where the state, again, has stepped up in a significant way. I think the more widespread we can have that testing, that isolation, that contact tracing, the quicker we're going to be able to lift this order that, in essence, closes down major parts of our economy, because we're going to be able to more surgically identify those individuals who are carrying the virus, and deal with them on a more specific basis. But right now, there are still a lot of people who they're afraid to go back to work. And we have to be mindful of that. And we have to be mindful that even with the progress that we have made up to this point, that there is still a lot of work to be done. And the worst thing we can do, even though we're seeing some evidence that the stay-at-home order is being successful, the worst thing we can do is to take our foot off the gas. So again, I am very concerned about the economic impact that this is causing people in their individual lives and in businesses. I'm very concerned about that. I think as all the people who are on this broadcast are concerned about. But I truly believe that the best way for us to get back to normalcy is to squash this thing as much as we can. If we take our foot off the accelerator too soon, my fear is all we are doing is we are permitting a return of this with a vengeance. And what we know from history, what we know from the 1918 pandemic that affected this country, was that it really came in three waves. There was the first wave in the first part of 1918, and then it subsided, but it came back with a vengeance in the fall of 1918, and then the following spring. So we have to, I believe, stay vigilant and work with the state, work with each other, and work most importantly with our health community and our public health experts, so that we can do everything we can to, again, get back to where we all want to be. So with that, I'm going to turn it over to County Executive Apley. Thank you very much.
Thanks, Mayor. Just along the lines of what the mayor was saying, relative to the governor's order, I agree. It was something that I think we expected, and I think it's something appropriate. One of the metaphors I've been using is if you're in your house and somebody smells smoke and you discover there's a fire, you don't put the fire most of the way out and think, you know what, we got it. I'm going to go sit on the couch now and watch the rest of, Lost reruns. You put the whole thing out. And I absolutely want to get businesses back to work. And it's not just businesses, it's the jobs. That's what's important. There are a lot of resources. The county's put up a site that lists a lot of the resources that people can have, that employers can have, and particularly small businesses. MMAC has done the same, and I encourage people to check that out. The mayor, myself, the state, we are all working on getting as many resources to help us get through this. You probably saw recently at the airport, we got just about $30 million, which it may surprise you, given the downturn in traffic there, it buys us months, not a year of operating. But we're going after every dime we can, and that's something we'll do aggressively. But I just want to reiterate, this is not about, progress doesn't mean you let off the gas. We still don't know because we had this big election and thousands of people, and just because it was a few days ago, and in this crisis, we tend to think about day-to-day news. As has been pointed out, we're not going to see if there's a significant uptick from that until towards the end of this week. And again, the worst thing we could do to get businesses back to work safely is to relax here. And I know the governor wants to see people getting back to their jobs. And the way I think to think about it is less about a date, but about the variables that we've been talking about for a while. The 14 days in a row of declining increased case numbers, the capacity at hospitals, where all hospitals having more than enough capacity to take an increase. We want to make sure we're doing this not on an arbitrary date, but when it's safe. Part of why the county has added more of these details to the dashboard, and the one on hospital capacity, which we talked about the other day, the one that shows each day's increase or decrease in the number of cases or new additional cases, where you can track that, is to make that line visible. But I think this is the right thing to do. And honestly, all of us looking back, a couple of years from now, would all rather apologize for being overly vigilant and keeping us safe than apologize for wanting to get back to work too soon and causing another giant uptick, as the mayor has said, is what happens. We've seen it again and again. That's not an abstraction. It is what happens. It's reality. With that, I will turn it over to Dr. Weston to talk about today's numbers. As you all saw, we hit a break point that's not a happy one to see. The fact that we've got over 2,000 confirmed cases is not something to be excited about. And that's an awful lot of people and an awful lot of lives, and it's all of their families and the people they work with. And we just need to think we can never let these numbers become an abstraction. These are people and lives. Dr. Weston?
Thank you, Mr. County Executive. Good afternoon. So as the County Executive mentioned, we are over 2006 to be exact, cases in our county, and 103 individuals who have died. We are seeing an apparent trend over a few days of increasing numbers of cases the last 3 days. So we'll certainly keep a close eye on that and see where that goes. As we discuss the extension of the stay-at-home policy and when and how to pull back any policies in a measured manner, there are four main areas that we as a city, county, and municipalities are watching closely. So first, we're monitoring our local numbers to ensure that we have a sustained decreasing trend in new confirmed cases of COVID-19. And this is not just over a couple of days, but more on the scale of a couple of weeks to consistently see declining numbers. Second, we want to confirm that we have an adequate number of tests and the ability to run those tests. It's no secret that there's been and continues to be a national shortage of available testing supplies and testing capacity. As the mayor mentioned, we're working at a local as well as a broader level to enhance our testing capacity so that we're able to evaluate those in need. Third, once we have a positive case, we want to be able to effectively trace their contacts and work with that patient to receive treatments or isolation as is appropriate for their case. And our health systems, our health departments have done an outstanding job working together to maximize their capacity on patient investigations. And fourth is health system capacity. And so as we've discussed, there's a variety of models projecting how COVID-19 will affect our community in the future. And while they differ in details, what they all have in common is the emphasis on social distancing as the key element for slowing the spread of the disease. And likewise, all the models that are now emerging, including our own from the Medical College of Wisconsin and the UWM-Zilber School of Public Health, show that certainly abrupt, but even gradual loosening of the stay-at-home precautions will result in an increase in cases and an increase in need for hospitalizations. And while this doesn't mean we can never pull back on social distancing, it does mean that it must be measured and that we need to be prepared for what is to come. And in this preparation, we've ensured that our fire, our EMS, our 911 systems are able to care for an increased number of patients and allow those patients to reach a facility that can best care for them. Additionally, we've worked with our hospital systems to maximize the number of patients they can treat effectively and that they have the resources needed to do that. And we're preparing our alternate care facility to be ready should an increased number of patients arise. So through these four key steps, again, monitoring trends, maximizing testing ability, optimizing tracing efficiency, and ensuring EMS and healthcare system capacity, we're preparing for what is to come. And we are making progress. Stay at home is working. Our curve does appear on initial review to be flattening, and that is due to these efforts. And as I said yesterday, this is a time for ongoing diligence in social distancing to ensure that we continue to move our trend in the right direction. Thank you and stay safe, and I will hand it off to Darren Roush.
Thank you, Dr. Weston. I'm happy to be here today representing our health departments in Milwaukee County And with the governor's orders today, we certainly want to talk about setting expectations about what happens after those orders end next month on May 26th. It's important to know that things will not go back to normal on May 27th. Over the last several weeks, the Safer at Home order has slowed the spread of COVID-19 in Milwaukee County. We know that there are fewer people who are sick because of this order, and we also know that lifting the order too soon will put our community at risk. Public health experts are closely monitoring those 4 things that Dr. Weston mentioned to determine when the Safer at Home order should be lifted, and a measured approach is appropriate in going forward. So I wanted to take some time here today. We do have some epidemiological data about the situation that I can share today, and it does really emphasize the importance of the continued Safer at Home order and the continued need by all Milwaukee County residents and residents of the state to continue to do the things they can do to limit the spread of COVID. On my screen here, the first slide I want to show is looking at cumulative cases of COVID. This is across the state in black, in Milwaukee County in purple, the Milwaukee Metro region, which is the 7-county area, in blue, and then the Waukesha, Ozaukee, Walworth counties in green. What we see here is that our doubling rates for COVID infections, early on, we were doubling in a day. We were doubling in 2 days. More recently, as we get out here to 30 days since the first time we had 20 cases, we're seeing that doubling rate decrease to 8.8 days. So that means the rate of cases we have in the county is doubling every 8 days. That is a sign that we are approaching flattening the curve. We are approaching that apex. Additionally, I have some more slides I'll show here, more graphs here. I'll show about demographics of confirmed cases, and we can certainly share this with the media electronically after this press briefing. But you see here, rates are still continuing to increase. This top left picture is just looking at overall numbers of cases, and with every one of these stair steps, that represents an increase in cases each and every day. On the right here, we see the difference by age. So those in their 20s and 30s are this third line here. This disease is mostly impacting those in their 40s and 50s in Milwaukee County. We know race and ethnicity has been a trend, and we see a large number of Black or African American individuals in the county that have come down with COVID. Our white race is here in blue, and we do have a large number of unknowns that we're still looking to figure out what they are and ascribe the correct race and gender, race and ethnicity to them, excuse me. And then on the bottom right here, we see gender and the differences between males and females are having more cases of COVID. We also have these data tables by hospitalizations and by deaths, and so we can certainly share these later. I want to mention, though, as the county executive mentioned, these aren't just numbers. These are people's lives. These are, people in our community that have come down with this, and their families and themselves have been significantly impacted. Testing was an issue that was raised by Mayor Barrett. Here we have a graph of testing coverages daily, kind of a cumulative look at both negative tests, which we're nearing 10,000 negative tests, and positive tests, where we have 2006, as was mentioned earlier. Weekly, we can look at that data here, and we can see that there's been generally a leveling of testing with a slight decrease last week, and positivity rates are pretty much consistent over that time. But to Mayor Barrett's point, I want to echo that to do the work of controlling COVID well, the next step we need to take is to really increase and enhance that testing capacity across the healthcare system. Lastly, I have a set of spatial maps. And this first map is a crude incidence map for COVID, so newly diagnosed COVID across the county. This particular map covers the entirety of the pandemic, so March 12th through April 15th. And the darker red color means the higher rate of COVID disease, the higher incidence of disease. And you can see that we have some pretty significant areas where there's lots of disease going on. throughout the county. And then you can see on this map, we are looking at just what's been happening in the last week. So this is April 7th through April 13th. So these maps are very important to us in public health as we identify the hotspots, as we identify where we need to intervene, educational messages, and the aggressive testing and outreach that we can do to certain communities throughout the county. So with that, I will stop sharing and turn it over to Mayor Kennedy.
Thanks. And go ahead, Mayor Kennedy.
All right. Thank you very much. Appreciate that. So I don't know that I have a whole lot of additional information to add other than to really sort of, I guess, underscore some of the messages that have already been given. I do believe that, those of us in the suburban communities are, in agreement with the things that Mayor Barrett said earlier, especially his call for increased testing. We know that when we have a limited amount of testing, those numbers that are not necessarily the most accurate. We may have many people that have been exposed and experiencing mild symptoms, and until we have the ability to greatly increase testing, we really do need to continue with the governor's stay-at-home order. I would say that from what we've seen, his order is working. We are seeing a flattening of the curve, and I would say that the governor did the right thing today. I've talked with a number of my colleagues today, and it's interesting. Everyone I talked to today from the suburban communities said that they believe that this was the right thing to do, that it is a hardship on many of our local businesses, but to keep things closed for a little longer, keep people at home for a more extended time will help us to continue to not max out our healthcare system, and also to be able to get this thing under control. And lastly, I believe that that we will need time. And the governor's order today does give us additional time to be able to put in place the kind of plan that will allow people to return to work, to allow businesses to open, to serve their customers, and to engage in full services of the services they provide, particularly our bars and restaurants. But we need to have a plan in place to be able to help those business owners to be able to engage with the public in a way that keeps everybody safe, and allows them to have time to train their employees as they get ready to reopen. So just underscoring a lot of the messages that have been given, and to say that, throughout the county, the mayors I've spoken with today are in full agreement with the things that have been said in this call by our suburban health officer, Darren, as well as, Mayor Barrett and others. So thank you.
Thanks very much, Mayor Kennedy. And we also have President of the Village of Brown Deer, Wanda Montgomery, with us to provide some additional reaction from suburban mayors. President Montgomery?
Thank you. And thank you again for this opportunity just to share my perspective. Of course, I'm working from home, so I didn't see the governor's extension until I started getting messages from people. And as I think about that, he has our best interests at heart. And I know there are a number of people who are probably planning things that they wanted to do after next weekend and maybe into May. But this is something that we really have to take to heart and really follow these directions. As I think about this past Friday, when I had an opportunity to share my perspective, I had a number of people who reached out to me via my official email and through Facebook, even a person who had just gotten off work from one of the healthcare systems and just shared how much she appreciated the words that I spoke. These are people that are on the front line, that are going in every day, that are working to make sure that our loved ones, our family, and our friends are recovering from this. We know that we have a number of people who have passed away, and it's horrible. But what can I do? I mean, what I'm doing now by staying at home is really helping to flatten the curve, to actually keep those people that are going to work every day to have a better chance of not being affected by this. I shared on Friday, and I'll share today. I come from a family of 9 children. My mother is still living. I love to see my mother every week. I've not seen my mother in over a month. I have my siblings we get together once a month for family dinner. Have not done that. We plan a lot of events, but in order for us to be successful, I want to be able to continue to do those things. So what I would say to each and every one, let's practice that social distancing. I didn't know anything about social distancing before we heard about this pandemic. I love to be close to people, but right now I'm staying as far away as I can, not being funny about it, but it's important that we support each other through this. Wash your hands. Make sure that, you don't go out when it's not necessary. You can go out in your yard. You can take the walks, ride your bike. I'm participating in a Jump for Joy. I've been jumping rope either in my garage or in the driveway. But what I would say is grandmothers and mothers and aunts and uncles, this is affecting our community, the African-American community, more than it is anyone else. And we need to do our part. If you know of somebody that's just going to go out and do what they want to do, try and get to them and let them know. Tell them who you know who's been affected. I've seen too many people, and this isn't old people. These are people that are younger, that are being impacted. And maybe if they don't get the COVID-19, they might be a carrier that exposes somebody else. So how do we really work together? This is about community. This is about community. If we don't support each other, we can't expect anyone else to do it. This is a small part for us to do to make a difference. Thank you.
Thank you so much, President Montgomery. And since we have a question for you, I'm just going to jump ahead to that question really quickly. This is from Bruce Vilmetti with the Milwaukee Journal-Sentinel. And he asks for President Montgomery, the map of recent hotspots shows brown deer. Can you,
right.
And do you have any sense of why?
No, I don't. But what I can tell you is some of the things that I've heard, because residents do reach out to me. We still have people that are going out. Kids are going out, playing on the various playgrounds, basketball. They're going to the school property. And these are not always teenagers. Sometimes parents are taking their kids out for a break. And we have signs up. We have things, we've taken down rims. So we really need to, and I've been promoting it, the village has been promoting it, the North Shore Health Department. So that's why wherever we can, and I have a pretty active social media, but it's not just me, it's spreading the word. We need to each one reach one. And so because I heard that today, just like you did, brown deer, we got to do better. And so whatever I can do, I will.